a lot of people on wheelchairs and other people that receive other DME equipment are like, "Oh God, no, Nick, don't say that." I'm here to speak up, speak out, and speak loud, and this is it. This is what needs to be spoke up about, and this is what we need to speak out about, and this is what we need to speak loud about. And if those of us in the disabled community that are affected by it every day don't speak up and speak out and speak loud about it, nothing is going to change.
Welcome to the Nick Speaks podcast, where we speak up, speak out, and speak loud for the disabled community. Tune in every Tuesday, and don't forget to subscribe. And now your host, Nicholas Comstock.
Hi, everybody. Welcome to this brand new episode of the Nick Speaks podcast, the podcast dedicated to the disabled community, where we speak up, speak out, and speak loud about the issues that matter to the disabled the most. I'm your host, Nick Comstock. You guys, thank you so much for joining me on this Tuesday. I hope your Tuesday morning or your Tuesday afternoon is getting off to a great start. Or if you're winding down with me, I hope your Tuesday evening is going well. Whenever you're listening to this, I hope you're having a great day. You guys, I am so glad to be with you today. Today you're stuck with me. I don't have a guest, but I hear a lot of you love my monologues, so it's a lucky day for you. You guys, I gotta be honest with you about something. I am really, really frustrated. I'm going to take you through a situation that I have been going through since September of 2025. Maybe a little later, a little sooner. I know it's around fall of last year. I've mentioned it briefly here on the program in past episodes. Don't ask me what the episode numbers are because I don't remember. But I'm going to talk about it in depth today. So back in the fall of 2025, I went in to the Martha Morehouse Wheelchair Clinic, which is in Columbus, Ohio. And I have a therapist that is assigned to me that helps me with things on my chair, recommends what the APT reps need to do, all that type of stuff. She can recommend equipment for me, which is what she did last fall. For protection reasons and privacy reasons, I'm not going to mention the therapist's name because none of this is her fault. But anyway, last fall, I went into her and I said, I need a portable electric Hoyer lift because I'm not able to go to medical appointments. I'm starting to pick up travel with speaking engagements, and I need a portable electric Hoyer lift that I can go to, that I can use in the community. And she said, I have the perfect one for you. And she showed me the Smart Mo 150 portable patient electric lift. And it's this lift that folds down. You could put it in the trunk of your van. It is one of the lightest on the market from the research that I've done. And it's the best on the market from a couple different people that I've talked to, including one of our past guests, Rico Segovia from the Wheelchair Roundtable podcast. Shout out to Rico. And so I've had a couple different people tell me, look, this is the best lift on the market. Yes, this would be perfect for you. My therapist at the wheelchair clinic said, here's the problem. You're probably not going to be able to get it because most DME providers, even though that the Mo Smart 150 portable patient lift is a covered item by Medicaid, most DME providers are not going to purchase the item because the reimbursement rate that they receive from Medicaid is way too low. So the company is going to lose money on it. Now, I understand that companies are in business to make money. They're not in business to lose money. I understand that. At the same time, however, when you sign up to provide and you say, we will be a company that will potentially provide this covered item, you cannot turn it down just because the Medicaid reimbursement rates are too low. This is what I'm being told from people who work in Medicaid, and I've made other posts about this on social media, and I actually got hundreds of responses from across the country when I posted about this on Facebook a couple months ago. So in the county where I live here in Columbus, my case manager said to me, he called every DME company in the county where I live in Columbus and said, will you order this Mo Smart 150 portable patient lift? And they said no because of the Medicaid reimbursement rates. Well, like I've said, I've been told that a Medicaid DME provider is not allowed to say that. If the item is a covered item, they're not allowed to say we won't provide it because of the Medicaid reimbursement rate. They can say we don't have that particular item. We don't deal with that particular item, but they cannot simply say we don't purchase this item because of the Medicaid reimbursement rate, which is what all of the DME companies in my county here in Columbus, Ohio, and in another county in Richland County, which is about an hour north from where I am, said the same thing. The Medicaid reimbursement rates are too low. We're not gonna pay for this because of the Medicaid reimbursement rates. So I finally got sick of doing this, and I've been going round and round and round with a bunch of emails to a bunch of different people, and the response that I got from the folks in Columbus that are helping me deal with this is keep calling DME providers until you get one that's willing to do it. Well, that's not a viable solution. So I called somebody down in Medicaid that I know, and they said, this is the thing that pisses me off. I called them probably about a month or two ago now, and it took the person in Medicaid about 7 days to get back with me, maybe a week or two more, just because she wanted to have all of her information correct, and she's helped me on several different things. So she called me back and she said, Nick, all these companies need to do, all the DME provider needs to do is ask for a PA, which is a pre-authorization. That's a form that says we need more money for this particular item. The reimbursement rate's too low. Now, you just heard me say a few minutes ago that I've been going through this since September, early October, fall of 2025. I've just found out probably within the last month or two, after going round and round and making posts on Facebook, that all the DME company had to do was ask for a PA, prior authorization, or maybe pre-authorization. I may be saying it wrong. But those of you that are in Medicaid and ask for what they call a PA know what a PA is. And the fact that this is all that had to be done is ridiculous. And the people that deal with PAs on a regular basis know that that is all that has had to be done, because I'm sure they ask for PAs on a regular basis. But the problem is they probably don't want to do PAs because that means it's extra paperwork. So then people like me who need the equipment in order to have a full medical exam, go out on work trips, which I know Medicaid won't pay for an item to go out on a work trip. That's why we have to show that there's medical necessity, and there is, because even though medical offices are supposed to have wire lifts, they do not, and they do not have the proper equipment to transfer somebody like me in a wheelchair. So it's important for someone like me to have a portable lift on hand at all times. And for those of you that just say, well, you could use a crank lift, here's my question. Why is everything that a person with a disability needs considered a luxury? I think I've asked this question before, but I don't know who the hell is in Medicaid that literally looks at these pre-authorizations and these orders and says, oh no, they don't need this. It's a luxury. They can get along without it. We can do the cheaper option. But they never take a look at the person's case. They never talk to the person. They never talk to the family members to see what those family members and what that individual goes through on a daily basis. They're just signing a denial letter, and they have no idea the effect that it has on the person that they're sending it out to. And why is it that the right hand never knows what the left hand is doing? On Friday, I called Medicaid to say, hey, where are we with this? My DME company is telling me they're waiting to get information back from several people. That's all they're saying. And I'm saying, is there anything I need to do? But they're not telling me anything. And my Medicaid person was like, well, I told your case manager to call them and leave a message and give them a chance to respond. Give them a chance to respond. I've been dealing with this since October of last year. September of last. Give them a chance to respond. We've just finally got all you need is a PA. And now you want to tell me, oh, just give them a chance to respond. I'm not upset at the person in Medicaid, but it's just like the ball keeps getting thrown back and forth to one person, to the next person, to the next person. Then it gets thrown back to the same person. And the same person says, well, it's not my responsibility. It's that person's responsibility. And they have to do this. And I haven't heard back from them. And by the time you're done, it's like I should be getting paid a full-time job's wage to just advocate for my own equipment, because nobody knows what the hell they're doing. And I know I'm not the only one that's dealing with this. Are you kidding me? I mean, I'm sure that there are people like the lady in Medicaid that helps me, that is wonderful and that really tries to make a difference in the lives of people that are on these programs. But sometimes it's just like these people that are in these programs making these decisions. It's almost like they get joy out of making us tangle up in all the red tape nonsense. And do they know the stress? Do they know the sleepless nights that they are putting people like me through, that they are putting families through? I was diagnosed with sleep apnea last year. I was at a facility getting cared for. And to be honest with you, if my caregiver wouldn't have been there, I would have fallen, because they did not have the proper equipment to do the transfer. And plus, they said, we're not allowed to help you transfer. So if I would not have brought my caregiver, I would have been screwed. Not to mention the fact that I never received the proper sleep apnea equipment that I was supposed to receive. And so they told me, Nick, you have to redo a sleep study in the lab. I said, why should I have to do that? I never received the proper equipment. Well, that's just what you have to do. And so, because they don't have the proper equipment to transfer me, and I don't want to risk myself falling, I've been waiting to get this lift so that I can go redo a sleep study. So my life has been in the balance since September or October of last year. As far as medical appointments go, and as far as, you know what, just being able to go see my family, just being able to go spend the night in a hotel. I deserve that too, just like anybody without a disability. And I don't understand why our government doesn't understand that. It's been 36 years this July that the ADA was put in place, the Americans with Disabilities Act, and it hasn't been updated. I think it's high time that it be updated to say that medical equipment such as Hoyer lifts are medical necessities, not only for medical appointments, but so that people with disabilities can get outside of their four walls and live their life. Because honestly, I'll say it again, who the hell is making these decisions on what is a priority or what is a luxury and what is not? I can tell you who the hell is making these decisions. Nobody that has someone with a disability in their family. If they do, it's, well, we've always had to make it, so then they have to. Well, not everyone has your spirit of tenacity, okay? If you're someone in Medicaid who says, I know the red tape is terrible and my family goes through the same thing with my child with a disability, so then why the hell aren't you making change in Medicaid? If your family goes through the same thing and you're one of those people that is making or breaking the lives of families, denying things, but yet you have personal experience. This is just a hypothetical situation. If you're in the same situation I am, or another listener is in, and you're in Medicaid and you are at the powers that be that can make the decision on whether we deny or approve something, why the hell aren't you making changes to remove the ridiculous red tape? I can tell you why. Because once you get in a position of power and money gets put in your pocket, money talks, as they say. And that's why these systems stay the same that they are, because too many people don't want to get the money taken out of their back pockets that they were stuffed with in order to get this position. It's mind-boggling to me, absolutely mind-boggling. My county here in Columbus, other counties. I got to tell you, my county here in Columbus, I've lived here for almost a decade, and it's one of the hardest counties that I've ever lived in. In fact, I've had many people say to me, Nick, your county's great with resources, but I would never go there because it's hard to get anything approved. And it is. It is. I feel like I've had to fight. This is a totally separate issue from the lift. I feel like I've had to fight almost everything. And I know that my case manager is going to call me and be like, what are you talking about? Don't even get me started. I was told that an automatic door opener would be a duplication of services because I have 24-hour staff. An automatic thermostat would be a duplication of services. My case manager has since found out that that is not the case. That's the way it used to be, I guess, but it's not the case now. And let me just say this. I love my case manager. I think he's a great guy. None of this is on him. Are there things that he could improve upon? Yes. Case manager, don't call me and ask me what those things are, please. Thank you. It's just so frustrating because I know that my county is not the only county that struggles with getting things approved, or I know that people around the country struggle with getting things approved. When I posted about this lift on Facebook and my struggles with it, I heard stories from all across the country of moms breaking their backs because they never could get their son or their daughter the lift that they needed because they didn't deem it a medical necessity. Who the hell is determining who the hell is determining what a medical necessity is? And that's what I'm waiting to find out now. Somebody said to me on Friday, they're like, we're waiting for a doctor to give you a certificate of medical necessity. Well, which doctor are you waiting on? Tell me so I can light a fire under their ass. Because I need this lift. I've got shit to do. I don't have time to sit here and be sterile in Columbus, Ohio. I mean, how bad is it going to have to get? Everybody likes to sit here and champion the ADA. Oh, yay, the ADA. Oh, so are we just supposed to be glad for something that happened 36 years ago and shut our mouth? That's why these advocates today suck. These advocates today suck, and I'll tell you why they suck. They suck because they are in the powers that be are in their ear telling them what to say. They are regurgitating what the powers that be say so that the powers that be can keep their money in their pocket. I've said this before on this program. I've said this before many times on my TikTok. If you're not following me, follow me at Nicholas Comstock on TikTok. The people who say, oh, yes, we want self-advocates. We want you to advocate for yourself, people with disabilities. Don't let anybody stop you. Yeah, you're okay with that until they come to fuck up with your system and tell you what's wrong with your system. And then once they start telling you what's wrong with your system, tone it down. You're too entitled. You're asking for too much now. Oh, wait, but I thought you told us to advocate. Oh, but now that we're messing with your money, and now that we're messing with the way your agency runs, our advocacy is no longer of need, according to you. Because now we've stepped over the line. But we need advocates who are not afraid to roll over the line. We need advocates who are not afraid to get on their knees if they have to and crawl into their senators' offices once again and say, listen, this is my story. This is what I need. This is what my community needs. And I'm the person to stick up for them. Guess what? We may not have to crawl upstairs anymore in 1990 like those did in 1990, the year that I was born, but we need some people making some serious noise about serious government disability reform because it sucks. And the government disability reform that we need is not more money from the government. How can we be a real advocate wants to know, how can I become more independent from the government instead of more dependent? Because I've said this many times, asking the government for more money and then telling them, but don't tell me what to do with more of your resources, that's not how this works. That's like going to your parent and you're 40 years old and you're still living in your parents' basement. God help your soul. And you're saying, Mom, Dad, I want you to fund every part of my life, but I don't want you to tell me when I can come in and who I can be with and how long I can be out and what I can spend your money on. This is a little bit different. Also, because you've, as a person with a disability, whether you're on a Medicaid waiver or whether you're on Medicaid or Medicare or Social Security, that money has been allocated for you. And the government should be making state and federal it more attainable for you with a disability to become less dependent on the government, whether that's more jobs or whatever the case. I've said it before, 22.7% of people with disabilities are gainfully employed. Why the hell is that number still so low in 2026? There needs to be serious government reform with Medicaid, with Medicare, with waivers, with Social Security, with everything. And we are not going to get it when we sit around and say, okay, we'll accept the crumbs. We don't want to be blacklisted or targeted as difficult. Listen, my county has already told me I'm difficult, okay? I don't care. I don't care. I was put on my case manager's caseload because I was difficult and I demanded people to do their job and I called out those who weren't. And I don't care about that. This is about my safety, my health, my well-being, and my ability to live my life. And I am allocated funds so that I can do that. But for some reason, the government likes to say, well, yes, even though you're allocated those funds, we can't use all those funds for you to live a healthy, fulfilling life. Really? Why? I mean, because I thought everybody deserved the American dream. I guess the inclusion, the DEI, this is where the inclusion in the DEI failed then, because people with disabilities, I mean, we're only allowed to have $2,000 in savings, and we can't have anything in stocks, bonds, and neutral funds. And if we get any help from friends, family, or somebody else, then we have to report the first $65 to Medicaid or to Social Security. Are you kidding me? Like, well, you have a stable account. You do know that they're starting to ask about that too, right? So, by the way, I don't have a stable account because it's not fluid. Let me tell you something else that I found out on Friday, and I'm going to do a little bit of digging into it because I just found out. I had lunch with a friend on Friday, and hopefully Social Security doesn't come after me because They bought me lunch. They may consider that an asset. I don't know. Um, but I had lunch with a friend on Friday, and they were telling me that Medicaid is working. They're trying to change it where it has to be 10 years before you can get a wheelchair instead of 5, because 5 is the same way all across the country. 5 years, you can get a brand new wheelchair. I'm actually going to get a new wheelchair this year, but they want to change it so it's 10 years. Really? How is that fair? Because there are a lot of people who lease their cars and they get a new car every 2 years. So why can't we get one at least every 5 years? Why does it have to be 10 years? I mean, it's obviously medically necessary that we need it. And do you think that we don't outgrow these things in 5 years? I personally, to be honest with you, I think it should be every 3 years. Because I don't know, I've been in this one for almost 5 years and I can barely sit in it without having any pain. And I know I didn't gain any significant weight in the last 5 years. I stayed between 263 and 265. That's where I am right now. But yeah, there's just so much red tape, and nobody knows what the right hand doesn't know what the left hand is doing. And somebody has to speak up, speak out, and speak loud and say, this needs to change. And Medicaid doesn't get to make these crazy rules. These DME companies don't get to make these crazy rules, especially when they're contracted through a government agency like Medicaid or Medicare. Because these DME companies, their position is, well, yeah, you say that we can't deny it because it's a covered item, but who the hell are you to tell us what we can do with our business? Well, when you sign up to do business with a large insurance company like Medicaid, I'm pretty sure they have a hell of a say. I'm pretty sure Medicare has a hell of a say when you contract to do business with them. If you don't want to follow their rules or their guidelines, get out of business with them. I know a lot of people on wheelchairs and other people that receive other DME equipment are like, "Oh God, no, Nick, don't say that." I'm here to speak up, speak out, and speak loud, and this is it today. This is what needs to be spoke up about, and this is what we need to speak out about, and this is what we need to speak loud about. And if those of us in the disabled community that are affected by it every day don't speak up and speak out and speak loud about it, nothing is going to change. That's why this podcast is here. That's why I do my TikTok. So I'm going to keep you guys posted on what happens with the Mo Smart 150 portable patient electric lift. As of this recording on Tuesday morning, I was told on Friday that we're still waiting on several documents. I don't know what those documents are. I have no idea. I have a feeling that the people that are still waiting on them have no idea what the hell they're waiting on either. Because if they haven't been able to tell me, how the hell do they know? So, yeah, I'll keep you guys posted on this, but this is ridiculous. A covered item should not have to be given a prior authorization, a PA, in order to be approved for a client. And if Medicaid needs to change their reimbursement rates, Great. Somebody come on here that's a DME provider and tell me what the Medicaid reimbursement rate is for a Mohs Smart 150 portable patient lift. And if you break down the math for me and you tell me this is why most DME companies won't provide it, and this is the pre-authorization, this is why we don't this is why we don't do pre-authorizations, because of all the paperwork, then come on here. Come on here and tell me that. Come on here and tell the world that, so that we can speak up, speak out, and speak loud and get this system changed and in the right direction that it needs to be in. The system is not going to be perfect, not in my lifetime, but I for sure as hell am going to try I'm for sure as hell going to try to make it as better as I can, better than the way it was before I came into it. And I hope that's what a lot of you advocates want to do, because honestly, like I said earlier in the episode, a lot of you advocates are weak. And I'm just going to tell you, and your parrot, because you listen to what the powers that be that are in your ear, and you're probably only with the powers that be so that it makes them look good. They actually don't really give a care about what you're advocating about. They only care about what you're advocating about as long as it doesn't make them lose any money. Get that in your head too. Anyway, I will keep you guys posted on what's going on with this Mohs portable Smart 150 portable patient lift. And if anyone that is in the company of this lift would come on my show, or maybe, hey, you could give it to me free and I'll sponsor you. You can be a sponsor if the lift ends up working out for me. And you know what? Here's the thing I've said several times. I've said I'm not a brand whore. If there's a better lift that works for me instead of the Mohs Smart 150 portable patient lift, then let's find that one. But I've been told more than once that this is the best lift, if not one of the best lifts on the market. And I should be able to have the best. And it's a Medicaid covered item. So obviously, Medicaid says it's the best. So if my insurance says they'll pay for it, then there should be no problem. But apparently there is, because there's all this red tape that I've had to go through. And it's ridiculous. Anyway, rant is over for this Tuesday morning, but I just wanted to share with you guys where I've been and what I've been going through. And hopefully by the next time I do one of these monologues, I'm going to try to do one monologue a month, but I don't know, because I really hate doing them. But this one felt right to do today. In the next couple of weeks, we will have guests, so stay tuned for that. I have great guests coming up. You don't want to miss those episodes, and I will keep you guys informed about what's happening with the Mohs Smart 150 portable patient lift. And if anyone who provides this lift, or who is at the company that provides this lift, would please reach out to me at nickspeaksofficial@gmail.com, or go to my website at nickspeaksofficial.com and just say, hey, we heard your episode. We would like to help you out. Great. I would really appreciate it. The problem is we need the insurance to pay for this, because we need a company to be able to perform maintenance on it. So that's why, unless, a company reaches out and say, hey, we'll give you the lift plus do the maintenance for you as long as you sponsor us, then, that's something we can work out too. but I'm just saying, I want to hear from parents and family members who have had to fight Medicaid, Medicare, waiver systems, Social Security. I want to hear from y'all because I'm told all the time, I know I'm not the only one. And I actually want to find out that I'm not the only one. So if you're dealing with certain issues, getting stuff approved, come on here. Let's talk about it. Let's change the system one approval at a time. And let's not stay quiet when we know we deserve and we need what we need. There's no way to get around it. So let's not stay quiet. Let's speak up, speak out, and speak loud. And especially for those who can't, let's get those who can't the systems and the services that they need. And let's begin a new disability revolution. I feel like we need to have a new, I was born in 1990. I was born in March of 1990. So I was not, as a Christian comedian, Mark Lowry says, I was barely developing eyelids when the ADA was formed and passed. I was born in March of that year, and the ADA was passed in July. So I really feel like we need a disability revolution, and I feel like the ADA, whoever's listening to this who has the power to do so, I feel like the ADA needs to be sincerely looked at and updated, because it hasn't been updated in 36 years. And let's start this disability revolution and not be quiet until we get the system that we want and we deserve. All right, you guys, thanks for listening to this episode. This is the Nick Speaks Podcast, the podcast dedicated to the disabled community, where we speak up, speak out, and speak loud about the issues that matter to the disabled the most. I am your host, Nick Comstock. I will see you next week. Bye-bye.
Thanks for tuning in to the Nick Speaks Podcast, where we speak up, speak out, and speak loud for the disabled community. If today's conversation resonated with you, please like, subscribe, and hit that bell so you never miss a new episode. You can find Nick across all platforms by visiting his Linktree in the show notes. And please leave a comment to join the conversation. Until next time, keep speaking up, keep speaking out, and keep speaking loud.